starting out the new year with Dr. Susan Van Dyke, just off Scottsdale Road. Wonderful office. In fact, I've had the pleasure to be there. And Doctor, your staff and crew, and I know Tanya would echo this, terrific people. The very best. You take great care of. So
we have wonderful people.
You really, truly do. So what have you laid out in front of us?
All right, so we were talking about spot fat reduction. CoolSculpting is this new procedure. It's been out now for over a year, and we've been doing it for about that amount of time. We've done hundreds. So you were asking earlier, you know, what size can you do? Well, this is basically the template for one of the hand pieces. So it fits really nicely on a tummy. And then what it does is it'll draw that tissue in using some suction. So it feels like it's grabbing onto you real hard. Yeah, but then if you have a love handle, different size, will fit that, or your bra fat. She doesn't want to turn for me.
There she is. Oh,
right there.
Okay.
So perfect. Or if we want to do an arm, like she's been over CoolSculpt, obviously, no fat on her arms, so you can do that. And that works really, really great.
Do they do a follow-up with you, doctor? Because you said it does take a little time for this.
Oh, yeah. I always see my patients back at about 4 to 6 weeks to see how they're doing. The side effects of it, pretty minimal, but everybody feels kind of numb and tingly in the skin afterwards.
As cold would do.
Yeah, and that goes away after a while. But you might have some residual like numbness for
that's understandable.
A month, and that's it. And the results are dramatic. I was in a clothing store the other day, and a woman ran up to me and said, "Dr. Van Dyke." I said, "Yeah." She goes, "Look at me, I'm shopping." And it was 1 month. And I said, "Don't buy too much because you've got 2 more months to go."
Really?
And yeah, especially if you do the love handles in the tummy, that
so it is different
waste
with
comes
each
right in.
person, though. It could be 25% to 30%, you're saying.
Yeah, well, actually it could be up to 40%, but really we kind of focus on, as far as realistic expectations, look at 20 to 25%, and you should not be disappointed. The only people who are going to be disappointed is if you gain weight, because that's just going to make fat everywhere. Now, just so you know that if you stay the same weight and you treat an area like this, it'll stay like that. In theory, forever. There's one gentleman who he was in pretty good shape, and he did one love handle but not the other because he worked for the company. So I guess they wanted to see what it looked like. So you have this great guy, and he looks awesome, and one side is straight and the other side is altitude. And then he went in, had a little dietary indiscretion, put on about 25 pounds, and I have another picture of him where he's still straight, where he was treated, and the love handle side where he was huge. And then he lost the weight again, and it went right back to normal. So it was really interesting proof that the fat, when it's gone, but if you gain weight, you're going to gain weight all over.
Well, it sounds like you're killing the fat cells.
You are dead, gone.
They're gone. And
That's
so
right.
how fat we are, how much we weigh, determines on how many fat cells we have.
Well, you know, that's when you're young is when you grow new fat cells. As you get older, there's a certain point that most of your fat cells are fairly determined. Like, it's thought that you don't make new fat cells past a certain age.
I'm so glad.
But
you make the cells fatter.
Exactly. Stop feeding your fat cells is what you need to do.
I'm just thinking, we got a bunch
How
of
long
fat
has
cells.
this been FDA approved?
It was FDA approved in October of last year, which would be 2010. And then it's been, it was used a little bit before that, but it's been widely used now for about a year.
Now, if someone comes in with this, and this,
yes,
can you do all 1, 2, it looks like 5.
The most
2,
we've
4,
done in
5.
a day is 7 areas on a patient.
Wow.
So you could conceivably do this, this, and this tummy in one session.
Absolutely. And we have, that's why we have this nice little CoolSculpting suite.
Wow.
We do a few areas, we order lunch in, person's eating lunch while they've got the little thing glommed onto them.
The burning question in my mind is, you put them in the hot tub after this?
And then what do? Warm them up?
We're thinking you'll be chilly.
What we do, it's interesting. That's a good point, because sometimes people will say during the treatment, well, it didn't work because it doesn't feel cold. Well, when we take that off, cold is an anesthetic. So as it gets cold, they don't feel it. It doesn't feel cold.
Numbing,
You take that little hand piece out, and I say, go ahead and touch it, and it's ice cold. And then we'll do a little massage, which feels good, and put a nice warm towel on it to warm them up. And within about 20 minutes, the redness is gone, and they're good to go.
Yeah, pampering's a big part of your practice.
It is a big part of our practice. We like to take care of people and make them feel special, and you know, and also give them what they want, is to get a little improvement. And everything we do is non-invasive or minimally invasive. We kind of hold a space that's between doing nothing and doing plastic surgery.
There's so many new innovations now, and of course Van Dyke is, you've grasped all of them and you're implementing all of them. How do you keep up with all the new
Yeah, it's
the
not
new
easy,
things.
but I go to multiple conferences
I
a
tell her
year.
everything I hear new.
And Tanya calls me when she reads something in Glamour magazine.
I think, didn't she
She
introduce
did.
you
A year
to this?
ago, she called me up and said, I heard about CoolSculpting. I want to know about it. So I said, okay, Tanya, let me go look into it.
Little known facts about Tanya. She's
Yeah,
cutting edge
she's on
a
top
lot
of
of these
it.
things.
Now, have
yeah.
you heard of something called liposonics?
No, akin to liposuction?
Yeah, and akin to CoolSculpting. So it's another way of spot fat reduction, different than CoolSculpting. Just FDA approved very recently. Medicis had it for a while, and another company has picked it up. But it's using focused ultrasound. You know, ultrasound, like you look at the infant. If you take ultrasound and you focus it very narrowly, it will generate heat. So it reduces fat the opposite way of CoolSculpting by heating up the fat.
And it does the same process, killing it and it's gone.
Killing it, and then it's removed slowly over
So
4 months.
essentially, Van Dyke, it's a full body kind of thing.
Turns out.
Obviously, you take very good care of the face, but also the fat in the body. And
Well, I used to think we did only face, then kind of CoolSculpting came along, and my patients were very amenable to this, so now we're going into more of non-invasive fats.
Love you.
Me too.
well, thanks
you,
you, Doctor. Happy New Year. All the very best.
Now, let's see, we've stopped smoking. We have stopped drinking so much. We don't spend time in front of the computer. Our fat is frozen
Yes.
and going to go away.
I like that.
Now we can run a marathon to get into
Ooh.
shape in Sedona when we come back.